You went to use the bathroom and you saw blood, then your heart just dropped. It wasn't a lot though, maybe a few drops on tissue or a small stain on your pants. But now your mind is racing and you're thinking to yourself, I thought I was pregnant. Am I losing the baby? Was what I had earlier not implantation bleeding? Why am I spotting again? Or is it my period? All these thoughts just keep racing in your mind because you've been hopeful, you've been tracking your cycle, your symptoms, you've been feeling different. You might have already watched our video on the difference between implantation bleeding versus period, or how to know if you're pregnant or if it's your period coming. But now you're bleeding. Suddenly, all your hope feels like it's sleeping. The truth is, you can bleed in your first trimester and still be pregnant, but not all bleeding is harmless. That is why understanding what kind of bleeding you're seeing is very important. Because if you assume it's your period, you might give up too soon. And if you assume it's normal spotting, you might ignore a real warning sign. So this video is going to help you tell the difference clearly. I'll be talking about what causes spotting in early pregnancy, which signs are normal and which signs means you should get help now, and also how to protect your body and your peace of mind through it all. I am not Sandra, and on this channel we'll talk about understanding your body, your health, and your fertility. If you haven't seen our video on when to test for pregnancy after implantation, I highly recommend you watch that video next, because sometimes the signs come before the line even shows. Now let's talk about the causes of spotting in early pregnancy that can be normal. The first one is implantation bleeding. This usually occurs 6 to 12 days after ovulation. The color is light pink or brown. It is usually different from your regular period. It can last a few hours to 1 or 2 days max. It usually don't have clot, no strong smell, and the pain is usually mild to none. So if you're unsure whether you had implantation bleeding, check our video on the difference between implantation versus period. I explained all the signs in that video. The second thing that can cause first trimester bleeding is hormonal bleeding or false period. This would usually happen around the time your period would have come, and it is due to hormonal shift as your body is trying to adjust to pregnancy. It may come as light period, which can be confusing, and this often happens in the first 4 to 6 weeks only, and it's usually harmless, but it's worth tracking. It's not something you should just ignore. The third one is cervical bleeding. This is caused by increased blood flow to the cervix, and you'd usually notice this after intercourse or vaginal examination. It's usually light pink spotting, it stops quickly, and it's painless. If you're finding this helpful so far, please hit the like and subscribe button so other women out there will get to see the video and learn from it. Now let's talk about the type of bleeding that needs urgent attention. The first one is heavy bleeding with clot. If you've already tested positive and you notice you're having heavy bleeding, it's soaking through pads, passing large clots, and looks like a period or even heavier, please do not ignore this sign. It could be a miscarriage or other complications. Do well to see your doctor immediately. The second one is severe cramping plus bleeding. If you start to experience sharp pain, especially on one side, accompanied with bleeding, it may be a sign of ectopic pregnancy. Please do not ignore this sign. Go to the hospital immediately and see your doctor. And the third one is bleeding that lasts for days, especially if it's bright red and it doesn't lighten. That needs to be checked immediately. Trust your body. If something feels off, don't wait. Don't even ignore it. Don't say it's this or it's that. Make sure you're talking to your doctor. Now, another thing we're going to be looking at is, how do you know what is really happening in your body? If you're spotting but still having other pregnancy symptoms like sore breast, nausea, fatigue, a positive test line that is getting darker, then the bleeding may be harmless, but it's always wise to get it checked out by your doctor. A blood test or ultrasound can help confirm what's going on. Now, the thing is, spotting in early pregnancy is scary, but it doesn't always mean something is wrong. In this phase, your body is adjusting, your hormones are rising, and sometimes the early days of pregnancy are a little messy. But knowledge is powerful. So if you're experiencing any form of bleeding, don't assume the worst, but also don't ignore. Just check in with yourself, get the help you need, and stay hopeful. You are not alone in this. I wish you all the best in your pregnancy journey, and I pray it ends in testimony and positivity. Please, if you're yet to like this video and subscribe to my channel, what are you still waiting for? Please subscribe to this beautiful family and join this amazing community. Also share this video to as many women in your life, and always remember, your health is your wealth. Little changes makes a big difference. Thank you for watching, and I'll see you in my next video. Bye.